Good evening, everybody. You all are with Nurse Jackie, and today we'll be going over the body systems, and I'll be doing the training for Florida Training Academy. If you guys have any questions or anything, let me know. I am a little nervous. This is my first time by myself, and also want to thank you guys for your patience for waiting on me. Let's go ahead and get started. All right, let's see, just 1 second. All right, so the central nervous system is made up of the brain and the spinal cord. It controls everything the body does, from movement, breathing, and heartbeat to thinking, memory, and responding to pain or danger. It's important that you guys should understand that the central nervous system, also known as the CNS, helps CNAs recognize early signs of serious conditions like strokes, seizures, or head injuries. It also improves their ability to care for patients with dementia, Parkinson's, or spinal cord injuries by recognizing behavior changes, mobility issues, or communication difficulties, ensuring timely reporting and safer care. So we are going to go through some test questions and with rationales, and I'll elaborate more whenever we're going through the rationale. So make sure you guys grab a pen and paper to take your notes and track your answers. Drop your scores or answers in the comment section. I'll be looking at that as we go through them. And then don't forget to like, share, and subscribe for more CNA practice tests. Let's get started and good luck. All right, so question number 1. Hello, everybody. Thank you again for joining me. What is the primary function of the nervous system? So option A is pumping blood through the body. Option B is controlling body movements and transmitting signals. C is producing hormones for metabolism. Or D is breaking down food for energy. I'll give you guys a few seconds to answer that. See a lot of B's in the comments. Just had a lot of responses all at once. Good job. Okay, let's go to the next one. The correct answer is B. You guys are so smart, and thank you for participating. Controlling body movements and transmitting signals. So the rationale is the nervous system is responsible for sending messages between the brain, spinal cord, and the body to control movement, sensation, and organ function. Great job. Everybody answer that right in the comment section, so keep up the good work. Question 2. Which part of the nervous system controls involuntary actions like breathing and heart rate? Option A is brainstem, B is cerebellum, C is the frontal lobe, or D, the hippocampus. I think this one's a difficult question, so you guys just take your time answering, but I'll give you a few more seconds to answer, but just think really hard. See a lot of B's in there, a couple A's, and we will reveal the answer in 3, 2, 1. The brainstem. So the brainstem regulates vital functions such as breathing, heart rate, and digestion without conscious effort. Good job, you guys. Now we're on to question 3. A patient suddenly becomes confused and has difficulty speaking. What should the CNA do first? Option A, tell the patient to rest. B, encourage deep breathing. C, report immediately to the nurse. Or D, offer a glass of water. Sherry, I'm reading your message. Let me see. I had to go back up. Good job for passing your test. Congratulations, and thank you for sharing that. All right. So the correct answer for this one, I'll reveal in 3 seconds. In 3, 2, 1. The correct answer is C, report it immediately to the nurse. So sudden confusion and difficulty speaking are possible signs of a stroke and require urgent medical attention. Question 4. Which of the following is a symptom of a stroke? A, sudden weakness on one side of the body. B, increased appetite. C, slow, deep breathing. Or D, sharp stomach pain. I'll give you guys a little bit to answer that. So if you see the abbreviation CVA, that's also known as a stroke. So be mindful of that. I see a lot of A's. All right, let's go ahead and see the correct answer for this. Yes, the correct answer is A, sudden weakness on one side of the body. So a stroke may cause weakness, numbness, or paralysis on one side of the body, along with slurred speech and facial drooping. So one thing to know, like if a patient has had a stroke, always be patient with all your patients, but they may move a little slower. They may have some difficulty speaking. They may get frustrated with you, maybe even start crying because it's hard for them to express themselves. So just be patient and always remember to be the nurse or the aide that you would want as a patient. So be a caring and compassionate person. And then also another thing that I like to share, like if you were getting someone dressed who had a stroke, you would want to start dressing the weaker or the affected side first so that it makes it easier to put the clothing on. Now we're on to our next question, question 5. So what does the acronym FAST stand for in stroke recognition? Option A is face, arm, speech, and time. B, feet, alertness, speech, and temperature. C, fingers, arm, sensation, and taste. Or D, attention, face, attention, swallowing, and temperature. Sorry. I'm seeing some people who were here last week. Thank you guys for joining and being faithful. We appreciate that. All right, let's see. The correct answer is A, face, arm, speech, and time. So FAST helps identify stroke symptoms such as facial drooping. So sometimes if someone has had a stroke, you may recognize they have facial drooping on one side of their face. Arm weakness, so if you ask them to lift their arm up and it just kind of drops right down, that's another symptom of it. Speech difficulties, you may notice that they usually speak clearly and now it's muffled, it's kind of hard to understand them, or it's just not clear. And then all these things would mean that they need immediate medical attention. All right, so next question, question 6. A resident with Parkinson's disease, is most likely to have difficulty with A, hearing, B, coordination and movement, C, breathing, or D, digestion. All right. I'll give you guys 5 more seconds to answer this. 5, 4, 3, 2, 1. All right, the correct answer is B, coordination and movement. The rationale for this: Parkinson's disease affects motor control, leading to tremors, stiffness, and difficulty with balance. So with knowing that, always make sure that you understand that the patient is high risk for falls if they have balance issues. So make sure that you're using that assistive equipment, such as like a gait belt, or if they have a walker or a cane, and also follow the care plan. Make sure that you're doing everything that you're supposed to with that. All right, question number 7. Which safety measure is most important for a resident with Parkinson's disease? I may or may not have just gave you the answer. So, option A, keeping the bed in a high position. B, encouraging the resident to move quickly. C, encouraging the resident to walk alone. Or D, assisting with ambulation to prevent falls. So, this question kind of bounced off of the last question. So, let's see what we have here. You guys are so smart. I'm so proud of you guys. Good job. The correct answer for this one in 3, 2, 1. D, assisting with ambulation to prevent falls. So, as we said previously, Parkinson's disease increases the risk of falls due to balance issues and muscle rigidity. All right, question number 8. A resident with dementia starts wondering, what should the CNA do first? So with this question, remember that they're asking you, what should you do first? Not only what you should do, but we're prioritizing here. So should we A, lock the resident's room? B, redirect them gently back to a safe area? C, call the family to take them home? Or D, ignore them unless they leave the building? So which answer do you guys think is correct? Lots of B's. Give you guys a few more seconds to answer this. Okay, here we go. The correct answer is B, redirect them gently back to a safe area. So dementia patients may wander due to confusion, so redirection helps ensure their safety. So be mindful that it also says gently, because if they are already confused and you come in and you're kind of guiding them, being forceful, they may feel like you're trying to hurt them. So be gentle with them, be patient with them, and then get them to an area where they are safe. Sometimes you may see the term elopement. They are high risk for elopement if they're wondering, because they could leave the facility. So just be sure this was question was on a test. Sometimes you'll get repeated questions and different things. One time I had took a test and I actually had that same question on my NCLEX test. So I was very happy that I was confident in that answer. So I'm glad you guys were able to see that again. But yes, be sure safety is very important with this. All right. Question number 9. A patient with multiple sclerosis may have which of the following symptoms? A, memory improvement. B, increased energy. C, high blood sugar. Or D, muscle weakness and vision problems. Starting to see more people from last week too. I seen Tori, Naomi, Elaine. Thank you guys for joining. All right, a few more seconds here. 3, 2, 1. The correct answer is D, muscle weakness and vision problems. So the rationale, multiple sclerosis affects the central nervous system, causing muscle weakness, coordination problems, and vision disturbances. So if you have someone who has assisted lenses or they need to wear glasses, make sure that you have their glasses on, because they may have more issues with seeing. So it's important that they can see the world through a clear view. All right, number 10. What should a CNA do if a resident with Alzheimer's disease becomes agitated? A, speak in a calm voice and offer reassurance. B, restrain them to prevent harm. C, raise your voice to get their attention. Or D, leave them alone until they calm down. All right, let's see. Let's go ahead and answer this one in 3, 2, 1. A, speak in a calm voice and offer reassurance. So the rationale, a calm, reassuring approach can help de-escalate agitation in residents with dementia. And I feel like that also goes a long way because you don't want anyone yelling at you. So even if a person comes and they're calm, it just brings the situation, it lightens the situation, it brings it down, it makes it easier to get to common ground with them. All right, question 11. A resident with a spinal cord injury is at risk for option A, dehydration, B, pressure ulcers, C, high fever, or D, increased mobility. Lots of B's here. So you kind of have to do some critical thinking with this one. We'll reveal the answer here in just a second. Okay, 3, 2, 1. The correct answer is B, pressure ulcers. So you guys did really well with this one. So the rationale is limited movement due to spinal cord injuries increases the risk of pressure ulcers. So regular reposition helps prevent them. Did you guys know it only takes 2 hours for a pressure ulcer to present itself? So making sure that you're repositioning your patient, that there's no wrinkles in the sheets, all those things can contribute to not getting a pressure ulcer because once they start, they're difficult to treat. And sometimes people, they don't heal, but sometimes you can get them to heal. So prevention is key. All right. Number 12, what is an important safety feature when caring for a resident who has a seizure? A, hold them down during the seizure. B, place a soft object under their head. C, give them food or water immediately. Or D, move them to a wheelchair. I am proud of you guys. You guys are so smart. You guys are doing really good. I see a lot of correct answers in the comment section. Hi, Maya. Thank you. All right, let's go ahead and reveal the answer in 3, 2, 1. The correct answer is B, placing a soft object under their head. So the rationale is protecting the head can prevent injury during a seizure. Never restrain the person or the resident or place anything in their mouth. So it's very important that we never restrain anyone because 1, we could break something. 2, we don't put anything in their mouth because they could choke on it. And then placing a soft object under their head will help prevent a head injury. We all know that if their head continues to hit the floor, they can have a head injury, which could lead to more issues. So placing that soft object under their head will add protection to that. Yeti Boss TV, thanks for helping me pass my CNA exam. Congratulations on passing. You guys see Nurse Eunice in the comments. She's watching with us. Thank you, Nurse Eunice. All right, question 13 out of 50. Which nervous system disorder affects memory and cognitive function? A, Alzheimer's disease, B, COPD, C, osteoarthritis, or D, anemia? So we're looking to see which one is affecting memory and cognitive function. All right, we will reveal the answer in 5 seconds. 5, 4, 3, 2, 1. The correct answer is A, Alzheimer's disease. So the rationale, Alzheimer's disease can cause progressive memory loss and cognitive decline. So this says it's progressive, so it's going to continue to get worse, and then their cognition will decline. So the correct answer is B. Great job for that. Or correct answer is A. I'm sorry. Great job for them. Yes, Kirsten, good job for your process of elimination. Okay, question 14. What is the function of the cerebrum? A, regulating breathing. B, controlling voluntary movements and thinking. C, pumping blood. Or D, filtering waste from the body. Okay, give you guys a few more seconds to answer that. All right, 3, 2, 1. The correct answer is B, controlling voluntary movements and thinking. The cerebrum processes thoughts, controls voluntary movement, and regulates emotions. All right, question 15. If a resident has difficulty swallowing due to a stroke, what should the CNA do? A, encourage them to eat quickly. B, offer large bites of food. C, report to the nurse and follow dietary recommendations. Or D, give them thin liquids. All right, good job, you guys. All right, we will reveal the answer in 3 seconds. And 3, 2, 1. The correct answer is C. I believe everyone got that correct, so way to go. Report to the nurse and follow dietary recommendations. Residents with swallowing difficulties may need modified diets to prevent choking or aspiration. So you may see that they have a puree diet. They may have a thickened diet where they can have thickened water. They may have, chopped, minced, moist. There's a lot of different options, but you may see different dietary modifications for them. How's my day going? It's going pretty good. I'm glad that everybody's here. It's my first one by myself. I'm feeling like a big, important adult right now, so it's going very good. Thank you for asking. All right. What part of the nervous system is responsible for reflex actions? A, the brainstem. B, cerebrum. C, spinal cord. Or D, hippocampus. Thank you, Naomi. All right. What do you guys think here? So the question's asking, what part of the nervous system is responsible for reflex actions? Again, I want to thank you guys for attending tonight and taking the time out of your day to watch and learn and grow. It means a lot. We have a lot of mixed answers here. Let's see what the correct one is. In 3, 2, 1. Spinal cord. So reflexes are rapid automatic responses controlled by the spinal cord. So you guys know if a person has a spinal cord injury, depending on the level of the injury where it affects the spinal cord, if they have some that affect the higher level, so sometimes with the C-spine, you may see that the person has issues with breathing after that. So spinal cord injuries can be very serious. So we always want to do what we can to prevent falls and injuries. All right. Question 17. If a resident with a spinal cord injury complains of numbness and tingling in their leg, what should the CNA do? A, encourage more movement. B, apply heat. C, ignore it since it's common. Or D, report it to the nurse immediately. All right. I'll give you guys just a few more seconds for this one. All right, here we go. The correct answer is D, report it to the nurse immediately. Numbness and tingling may indicate nerve damage or circulation problems, so be sure to report that to your nurse right away. 18, what is the main function of the peripheral nervous system? A, transport oxygen in the blood. B, connect the central nervous system to the rest of the body. C, break down food. Or D, store energy. A few more seconds for this one. All right. Let's see what the correct answer is. The correct answer is B, connect the central nervous system to the rest of the body. Is it possible to lose consciousness after a spinal injury? Yes, it is. It is a possibility to lose consciousness after that. So it can be very scary. The peripheral nervous system carries signals between the brain, spinal cord, and the body. So great job with that. 19, what should a CNA do first if a resident has a seizure? A, protect them from injury. B, place something in their mouth. C, restrain the resident. Or D, give them water. Medical terms coming in handy. Don't you love when you can just put it all together? It's like, yes, everything just kind of adds on to each other. Lots of A's here. Great job, you guys. All right, a few more seconds here. So then also remember, like if you've had a question like this already, whenever I'm taking a test, I like to go back and I make sure I have that last answer right that pertains to this question. So then I'm like, okay, yeah, this all makes sense. So we had one about seizures already, so I would just follow suit with that one. All right, here we go. A, protect them from injury. I seen someone said that safety is always the top priority, and it is. So good job for that. Ensuring safety by removing nearby objects and placing a soft surface under the head is priority. So let's say like pretend I'm having a seizure. So I'm sitting at the table and then I hit my head and I'm just start convulsing, like shaking back and forth. One thing that you want to do is, since I'm sitting like by a glass table, you just want to make sure that my head is safe. If you're able to scoot me a little bit to the side so I'm not hitting my head, that would be great. But the main thing is to protect the head and make sure that they're not in an area where they could be injured. Now, you don't want to do like a big transfer or anything like that, but if my head was going to be smacking this glass, then you would want to move that gently to the side and just kind of put that pillow under there. So make sure that we're preventing injury. All right, number 20. You are assisting Mr. Jones, a resident with Parkinson's disease, to the dining room. He begins shuffling his feet and suddenly stops moving. What should you do? Option A is encourage him to take big steps quickly. B, gently guide him forward and allow him time to restart. C, leave him and call for another CNA. Or D, pull him forward to help him move faster. Nurse Eunice really helped me pass my test. Danita, thank you for that comment. I'm sure that she has a heartfelt, deep feeling about that. So she definitely takes pride in educating, and I'm glad to see that you all are benefiting from it. Few more seconds to answer this one. You guys are doing very well. I am impressed. All right, let's see. In 3, 2, 1. B, gently guide him forward and allow him time to restart. So Parkinson's patients may experience freezing, making it hard to initiate movement. Gentle guidance and patience help them regain mobility. So just be gentle, be kind, and be safe. All right, question 21. You notice that Miss Lopez, who has dementia, is becoming increasingly agitated while you assist her with her dressing. What is the best action? A, stop and try again later when she's calmer. B, quickly finish dressing her to avoid a confrontation. C, scold her for resisting help. Or D, call the nurse immediately. So again, here you can use your process of elimination. Always choose the best answer. Some answers may sound good, but always choose your best answer whenever you're selecting the correct answer. All right, let's see. I see Stephanie in the comments. I see Adelina, Darlene, Miss Bonita. Thank you guys. All right, let's see what we have here. A few more seconds in 3, 2, 1. All right. A, stop and try again later when she is calmer. Dementia patients can become overwhelmed. If they're agitated, taking a break and approaching later can reduce distress. So if they're getting all worked up, you can just say, hey, I'll come back again later and we'll try again. Or you can, try to de-escalate the situation and find out the source. Hey, what's going on with you? Are you just not wanting to finish showering right now? And if they still kind of get agitated with you, you just say, we can finish this later. I don't want to upset you. And I hope that you feel better later whenever we try again. So you want to make sure you're being personal with them and also not making the situation worse for them, and always be kind and be reassuring to them. All right, number 22. Mr. Brown, a resident recovering from a stroke, is having trouble using a fork with his right hand. What should you do? A, feed him all his meals. B, encourage him to use his left hand or adaptive utensils. Or C, tell him to try harder. D, remove solid food from his diet. So he's recovering from a stroke. He's having trouble using a fork with his right hand. What are we going to do? I understand it can be scary, but some things are just not predictable. But at the same time, sometimes if you can make a situation better, you can always try. Lots of B's here. While we're waiting, somebody give me the medical abbreviation for stroke. See if you guys know this one. Anybody know it? What is the medical? Good job, Tori. Good job. There we go. Diana, good job. All right, let's see. We are going to see the correct answer in 3, 2, 1. All right, the correct answer was B. Encourage him to use his left hand or adaptive utensils. Encouraging independence with assistive devices helps stroke survivors maintain function. Yes, great job. So if the right hand's affected, they can try with the left hand. And these are built up utensils, so they're weighted. So like if they were shaking some, it kind of helps stabilize the hand. And then sometimes you may see like a curved spoon so that they can kind of drag the food to the end of the plate to curve it so that they can eat. And you always want to foster independence with them. So we may be able to do it faster, but is that teaching them anything? It's not. And then also with them doing it by themselves, it builds up that muscle memory. I used to work on the rehab unit, and you would see some patients would have a stroke. They would come to the rehab unit to get stronger. On day one, they were kind of frustrated with it. It was taking much longer than usual. By day two, they start getting better because they would get at least 3 hours of therapy per day. And by day 5, they would only stay with us for about a week or two. And then by the end, sometimes people were doing everything on their own because they learned those skills. So will it take longer? Probably. But are they there to build up their skills to get back to how they were prior to the stroke? Absolutely. So always be patient and be kind. All right, 23. While assisting a resident with multiple sclerosis to the restroom, you notice they're struggling with balance. What should you do? Option A, encourage them to walk alone to strengthen their muscles. B, provide support and use a gait belt if necessary. C, tell them to sit and try again later. Or D, move quickly to prevent falls. What do we think this one is? So they're going to the restroom, they're having trouble with balance. What is going to be our priority here? All right, let's see. A few more seconds here. All right, 3, 2, 1. B, provide support and use a gait belt if necessary. So multiple sclerosis affects coordination and muscle strength. So assisting with the gait belt helps ensure safety. So when they do have that gait belt on, you want to make sure the gait belt isn't too tight. One thing that I do, I stick 2 fingers in there to be sure that it's not too tight against the skin, because we don't want to cause any injury to the skin. But you want to make sure that it's on there good enough so that you can support the patient to help. And Nurse Eunice is in the comments. She says the next live is Wednesday at 6 p.m. So make sure that you guys tune in for that. She'll be doing 50 questions like you guys asked. I'm doing 50 today, and she'll be doing 50 on Wednesday. So tune in for that. It's going to be great. All right, let's go to question 24. Let's see. Hold on one moment. There we go. You are feeding a resident with late stage Alzheimer's. They suddenly begin coughing and having difficulty swallowing. What is the first thing that you should do? A, continue feeding at a slower pace. B, offer them a drink to wash down the food. C, stop feeding them and report to the nurse immediately. Or D, pat their back to encourage swallowing. Judy, I see you said you're doing your exam tomorrow. Good luck. I know that you'll do great. All right, a few more seconds, guys. All right, let's reveal the answer in 3, 2, 1. C, stop feeding them and report to the nurse immediately. So difficulty swallowing, dis, remember dis, the prefix means difficulty, and then aphasia, swallowing. And Alzheimer's patients increase the risk of aspiration. Stopping and reporting helps prevent choking. So if they're doing, if they're coughing and things during their meal, we want to stop that, and we want to report it to the nurse so that they can come and assess them and make sure that they don't have any foreign particles in their lung that they've aspirated, because that can lead to pneumonia, and that could be also, it could be painful and it could be difficult to treat for the patient. So we want to make sure that we are taking proper care with that. I seen someone said that they are going to, let's see, scrolling up here, doing my exam tomorrow. And here we go. Here's the comment. Priya, taking your exam next month. Okay. Good luck with that. And also, Shakina, same with you. Good luck. The Cobra, tomorrow I'm stressed. Study and make sure that you're well prepared for your exam and do the best that you can. When is the next Phlebotomy live? Sherry, I am unsure of that answer, but if you guys have questions that I can't answer, you guys can send an email to admin, that's ADMIN, at fltraining.com. So that's ADMIN at fltraining.com. All right, let's go to the next question. No phlebotomy live. All right, Nurse Eunice answered that one for me. Thank you, Nurse Eunice. All right, number 25. Mr. Carter has a spinal cord injury and has been in bed for several hours. You notice redness on his lower back. What should you do? A, ignore it since it's just minor irritation. B, massage the area to increase blood flow. C, reposition him and report it to the nurse. Or D, apply lotion and cover the area. What are we thinking for that? Lots of C's here. Good job, you guys. Good job. All right. I will reveal the answer in 3 seconds here. In 3, 2, and 1. The correct answer is C, reposition him and report it to the nurse. So the rationale, redness can be an early sign of a pressure ulcer. Reposition and early prevention prevent worsening. So redness can be one of the first signs of a pressure ulcer. It's actually one of the first signs of a stage 1 pressure ulcer. So pressure ulcers are staged, but we want to do the best that we can to keep the patient from getting one. So prevention is key. So repositioning them, adding supporting devices, so like pillows, and sometimes they have it in their care plan if they have any specific devices that they need. So we definitely want to prevent pressure ulcers. All right, you guys. So if you haven't done it already, please go comment, like, share, and subscribe. And our goal is 1 million followers. I know we can do it with you guys' help, and we appreciate you guys for tuning in. All right, the next one is discussing the endocrine system. So the endocrine system is made up of glands that release hormones directly into the bloodstream. These hormones help regulate important body functions like metabolism, growth and development, sleep, blood pressure, and blood sugar levels. So the endocrine system is very complex. So it's important to understand that by understanding the endocrine system, the CNAs can recognize signs of hormone-related conditions like diabetes, thyroid disorders, or adrenal imbalances. This knowledge helps them provide a better care, monitor for symptoms such as dizziness, fatigue, or changes in vital signs, and report concerns promptly to the nursing team, keeping patients safe and improving outcomes. Congratulations, Kamasus. All right, next one, 26. So we're about halfway done, you guys. Thanks for hanging in there with me. Which gland is primarily responsible for regulating metabolism? A, the pituitary gland, B, the thyroid gland, C, pancreas, or D, the adrenal gland? So which one is responsible for regulating metabolism? Becky, good luck on the nursing program. And yes, congratulations for passing. I'm happy to see that from all of you. All right. You guys ready for the reveal? A few more answers still coming through. All right, here we go in 3, 2, 1. The correct answer is B, the thyroid gland. So the thyroid gland produces hormones T3 and T4 that regulate metabolism, energy production, and temperature. So your thyroid is located in the neck area, as you guys can see in the picture. So what I want everybody to touch their neck, and you can kind of, if you lift up a little bit, you can kind of feel that groove in there. And like right through here, this is your thyroid. This is where your thyroid is located. All right, next question, number 27. What vital sign abnormality is most commonly associated with hypothyroidism? So hypo, think of what hypo means. And then let's select the best answer. So A, tachycardia, B, hypotension, C, bradycardia, or D, hypertension. Okay. I think I've seen more people come into the live stream, so thank you all for joining us and your participation. All right, here we go in 3, 2, 1. All right, the correct answer is B, bradycardia. So hypothyroidism slows down metabolism, which can lead to a lower heart rate. So remember, hypo is low, and when I try to remember things in my head, I kind of rhyme a little bit. So remember, hypo, low, and bradycardia is a low heart rate or low pulse. So you can just pull all those together, hypo and low. Thank you for returning, Mila. All right, next question, 28. A patient with hyperthyroidism may exhibit which symptom? A, cold intolerance, B, weight gain, C, heat intolerance, D, slow heart rate. See Chrissy in the comments, Tori, Risha, Miss Key, Love, Catherine. All right, few more seconds here. In 3, 2, 1. All right, the correct answer is C, heat intolerance. For the rationale, hypothyroidism increases metabolism, causing excessive heat production, leading to heat intolerance. 29. What is a key symptom of hypoglycemia? A is increased thirst, B is excessive urination, C is slow pulse, or D is confusion and sweating. What do you guys think for this one? When we say hypoglycemia, what are we talking about? Can somebody tell me in the comment section? Just a few words, nothing too elaborate, but what does that even mean? Anybody know? What does hypoglycemia mean? Because in order for you to get the correct answer, usually you have to understand what the question's even asking. So does anybody know what hypoglycemia is? Low sugar. Yes, low blood sugar. Okay, good job. Good job. All right. Thank you, guys. Good job for that. All right, here we go in 3, 2, 1. Confusion and sweating. So hypoglycemia is low blood sugar, and it often presents with shaking, confusion, sweating, irritability, and dizziness. So if you see someone and they're diabetic and they're just confused, they're starting to sweat some, you notice they're more irritable, they're not being themselves. Like you can just tell something's off. It may be their blood sugar. And some people can tell you when they know that their blood sugar is getting low, they're like, oh, I need to eat something. My blood sugar is getting low. So be mindful of that. All right, number 30. A CNA is caring for a patient with diabetes. The patient becomes shaky and confused. What should the CNA do first? So here we are again, the question's asking what should they do first? So we're prioritizing. A is notify the nurse immediately. B, check the patient's blood sugar level if permitted. C, give the patient water. Or D, have the patient lie down. Lots of A's in the comments. All right, you guys, 3 more seconds. In 3, 2, 1. The correct answer is A, notify the nurse immediately. So a CNA should recognize the signs of hypoglycemia, which we said is low blood sugar, and report them to the nurse, who can check the blood sugar and provide appropriate treatment. A patient experiencing menopause is at increase for which condition? A, hypothyroidism, B, osteoporosis, C, hypoglycemia, and D, hyperthyroidism. You guys answered this one pretty fast. Good job. Good job. All right, 5 more seconds here. And 5, 4, 3, 2, 1. All right, osteoporosis. So decreased estrogen levels during menopause lead to bone density loss, increasing the risk of osteoporosis. So with osteoporosis, one thing, you can pull this word apart. It literally means porous bones. So osteo refers to bones, and then porosis, it literally says porous in the word. So it's pretty easy to break down. And when I think of osteoporosis in my head, I just have an image of a sponge. You know how the sponge has like kind of like caved areas. So it's like with osteoporosis, these bones, they're not fully, like a regular bone would kind of be like, I would think of it as kind of like a solid structure. But then with osteoporosis, it has these holes in it. So it makes the bone more susceptible to fractures and things like that. So be sure that we're using fall prevention techniques with our patients who have osteoporosis as well. All right, 32. A common symptom of menopause is, thank you, Mila, A, weight loss, B, increased hair growth, C, hot flashes, or D, low blood pressure. So what's a common symptom of menopause? You guys are answering very fast in the chat to this one. I see a lot of C's. A lot of C's. So what's a common symptom of menopause? All right, a few more seconds here in 3, 2, 1. The correct answer is C, hot flashes. So the rationale, hormonal changes during menopause often cause hot flashes due to sudden vasodilation. So you hear a lot of people say, oh, I'm going through menopause, I'm getting hotter, the night sweats kept me up. That's due to vasodilation. All right, question 33. Which endocrine disorder is characterized by an excessive production of cortisol? A, Addison's disease, B, Cushing syndrome, C, diabetes insipidus, or D, Graves' disease? This is whenever I tell you guys the endocrine system is so complex. I feel like this is one of the hardest topics that I had to learn was the endocrine system. So many different diseases involved in the endocrine system. But you guys can learn them, and you guys are doing great participating. Let's see. So which one is characterized by excessive production of cortisol? All right. And 3, 2, 1. We will reveal the answer now. All right, the correct answer is B, Cushing syndrome. So Cushing syndrome occurs when the body produces too much cortisol, leading to symptoms such as a round face, weight gain, and high blood pressure. And there's a picture that shows a patient with Cushing syndrome. So you see all those different symptoms over there. A patient can have all those things from too much cortisol in the body. Do you guys know another, like a common thing that people deal with on a day-to-day basis that can increase your cortisol levels? It starts with the S, and it's a negative thing. Anybody know? Stress. Stress can increase your cortisol levels as well. All right, here we go. Question 34. A patient with Addison's disease is most at risk for A, hyperglycemia, B, hypertension, C, hypotension, or D, increased appetite. So now we're talking about Addison's disease. What are they at risk for? All right, you guys, I'll give you 5 more seconds for this one. In 5, 4, 3, 2, 1. Hypotension. So Addison's disease causes adrenal insufficiency, leading to decreased cortisol and aldosterone levels, which can result in dangerously low blood pressure. All right. 35. What is a common sign of diabetic ketoacidosis, also known as DKA? A is fruity smelling breath. B is a slow heart rate. C, increased salivation, or D, low respiratory rate. Common sign of diabetic ketoacidosis. So just a little side story here. My dad, he actually had diabetic ketoacidosis a few weeks ago. He ended up being in the hospital for it, and it's whenever your blood sugar is over a certain amount, and it's very dangerous. You could die from it. So he had one of the symptoms that's on this page, which I'll give you guys the answer in just a few seconds. He also had confusion. His breathing was just completely different. He had a lot of different symptoms, but he had a lot of different stuff going on. So one thing, if your patient is diabetic, make sure that they're checking their blood sugar, or if you have a family member who's diabetic, make sure they're checking their blood sugar, make sure that they are taking their insulin, make sure that they have glucagon or something with them in case their blood sugar gets too low at all times, because he just had a family emergency and forgot all his stuff at home, which ended up with him being in the ICU. He wasn't able to eat for a few days because his blood sugar was over 600, which is very high. He was on a lot of different fluids and things like that. So it's very scary. So make sure that your patient or family member, whoever it is, has their equipment, and that they're checking their sugars, and that they're giving themselves their insulin as they should. All right, let's see here. The correct answer is A, fruity smelling breath. So DKA occurs in uncontrolled diabetes, causing the breakdown of fats into ketones, leading to a fruity breath odor. So if you guys remember the gum, which they still have it, Juicy Fruit, that's what it smells like. It smells just very sweet. And that's the body's way of trying to get rid of some of that extra sugar by giving it off through the respiration. So that's why that will happen. All right, 36. Which endocrine gland controls blood calcium levels? Option A, thyroid gland, B, parathyroid gland, C, adrenal gland, or D, the pancreas. So which one controls the blood calcium levels? You guys are doing your critical thinking with this one. Looks like the comments are slowing down a little bit. All right, 5 more seconds here in 5, 4, 3, 2, 1. B, the parathyroid gland. So the parathyroid gland regulates calcium levels by releasing parathyroid hormone, also known as PTH, which increases blood calcium. All right, 37. A patient with hypothyroidism is likely to experience A, increased energy, B, heat intolerance, C, rapid heartbeat, or D, weight gain. What do you guys think for this one? All right, a few more seconds here to answer. In 3, 2, 1. D is weight gain. So hypothyroidism slows metabolism, leading to weight gain, fatigue, and cold intolerance. So remember, hypo, low, low and slow. All right, 38. The best time to check a fasting blood glucose level is A, immediately after eating, B, 8 to 12 hours after eating, C, before bedtime, or D, after exercising. What is the correct answer for this one? So remember, it's asking the best time and it's asking about fasting blood glucose levels. So breaking that question down. All right, 3 more seconds, you guys. In 3, 2, 1. The correct answer is B, 8 to 12 hours after eating. So a fasting blood glucose test is most accurate when performed after an overnight fast of 8 to 12 hours. Sometimes you'll see, I know at the hospital that I work at, they do labs around 4 in the morning. So the patient has had that time to fast so they get accurate levels there. All right. What dietary recommendation is best for a patient with diabetes? A, high sugar intake. B, low fiber diet. C, balanced carbohydrate intake. Or D, high fat meals. See lots of C's there. Couple B's. All right, in 3 more seconds, you guys. You guys are doing pretty good. Good job. In 3, 2, 1. C is the correct answer. So balanced carbohydrate intake. Patients with diabetes should manage carbohydrate intake to maintain stable blood sugar levels. So sometimes the endocrinologist, they may tell the person who has diabetes, you can have so many carbs per meal or carbs per day, but just making sure that they are sticking with that and not eating too many carbs, because too many carbs can cause the blood sugar to elevate. All right, question 40. Which vital sign is often increased in a patient with hyperthyroidism? A, the respiratory rate. B is the heart rate. C is temperature. Or D is blood pressure. Which one are we thinking for this? Which vital sign is increased with a patient in hyperthyroidism? Great job, you guys. All right, here we go in 3, 2, 1. B is the correct answer. Hyperthyroidism speeds up metabolism, leading to tachycardia, which is a fast heart rate. So think hyper, remember things are going faster. When I think of hyper, I think kind of like a hyper child. You see them jumping up and down, doing backflips and stuff like that. So hyper is fast. All right, 41. What condition occurs when a blood sugar is extremely high and dehydration sets in? A, hypoglycemia. B, DKA. C, hyperosmolar hyperglycemic state. Or D, Addison's crisis. It's our correct answer for that one. All right, you guys, 5 more seconds. In 5, 4, 3, 2, 1. The correct answer is C, hyperosmolar hyperglycemic state. That would be hard to say 10 times fast. So HHS occurs in type 2 diabetes when blood sugar levels are extremely high, causing severe dehydration without ketoacidosis. Yes, 41 was definitely challenging. Definitely. All right, you guys. 42. Which hormone regulates sleep cycles? A, melatonin. B, cortisol. C, insulin. Or D, estrogen. So we're talking about sleep. Lots of A's here. Great job, you guys. All right, a few more seconds here. All right, in 3, 2, 1. Correct answer here is melatonin. So the pineal gland releases melatonin, which helps regulate sleep and wake cycles. Mondesir, congratulations on passing. So you see what I just gave my kids so I can study. Is it bedtime already? I know you guys are in a different time zone. I'm at 7:44 Central Time, but yeah, some people do use melatonin to help them sleep. But also remember that it's produced in the body too, so that's a great thing. But sometimes a supplement is needed. All right, here we go. 43. What is a classic symptom of Cushing's syndrome? A, cold intolerance. B, weight loss. C, a moon face. Or D, low blood sugar. So again, lots of different diseases with the endocrine system. Talking about Cushing's syndrome this time. All right, 5 more seconds. In 5, 4, 3, 2, and 1. The correct answer is C, moon phase. The rationale: Cushing's syndrome causes fat redistribution, leading to a rounded face appearance. So again, the correct answer is C, a moon face. All right, 44. Which of the following is a long-term complication of diabetes? A, blindness. B, hyperthyroidism. C, hypotension. Or D, frequent infections. So we're asking long-term complication. That's our key word here. A few more seconds here. All right, in 3, 2, 1. Blindness. So uncontrolled diabetes can lead to diabetic retinopathy, causing vision loss. So we want to make sure that our patients are going to their eye doctor appointments, that they're getting their eyes screened, because we want to make sure that we're doing what we can to prevent the blindness. And, the most important part there is keeping those blood sugar levels within normal limits. All right. 45, we're at true or false questions. The adrenal glands sit on top of the kidneys and help respond to stress. Is that true or is that false? So in the comments, you guys can type true or false or T or F, whatever you prefer. Lots of trues here. All right. Miss Marianne says that it's true. Let's see if she is right. That is the correct answer. True. So the adrenal glands produce hormones like adrenaline and cortisol, which are essential for managing stress, blood pressure, and metabolism. They are located above each kidney. All right. 46. What type of diabetes is usually diagnosed in childhood? A, insulin resistance syndrome, B, type 2, C, gestational diabetes, or D, type 1. Is it true or false on the CNA exam in Florida? Let's see. I am unsure of that. Let's see if anybody else knows here. I live in Illinois, so Illinois is different than Florida, but if you don't mind to email that question to admin@fltraining.com, they will get back to you on that. Sorry that I don't know, but I will know from now on. So let's see here. So let's see if this answer is correct. All multiple choice. Thank you, Nurse Eunice. All right, here we go. 3, 2, 1. The correct answer is D, type 1. So type 1 diabetes is an autoimmune disorder that typically appears in childhood or adolescence. So just going back to these answers here. Type 2, always think type 2 comes later in life. So 1 or 2 comes after 1. So I think later in life. And type 1, I just feel like 1 comes before 2. So that's the way that I understand that in my head. And gestational, that would be like whenever, if a person was pregnant. Okay, 47. What should be done first if a diabetic patient becomes unresponsive? A, give them juice. B, call for help and check the blood sugar. C, administer insulin. Or D, place them in the Trendelenburg position. We're down to 3 more questions, you guys. You guys have done very good. Vanessa says B. Sherry says B. Vitalia says B. Let's see. All right, here we go in 3, 2, 1. The correct answer is B. Good job, you guys. I am proud of you. So we're calling for help and checking the blood sugar. Unresponsiveness in a diabetic patient could be due to severe hypoglycemia, hyper or hypoglycemia requiring immediate medical attention. B. Natalia says B. Let's see. All right, here we go. Nurse Eunice, I think your mic is going. Correct answer is B. Good job, you guys. I am proud of you. So we're calling for help. And there we go. All right. Question 48. What is a symptom of menopause related to sleep? Option A, increased sleep.
I think your mic is going. Excellent speed. Good job, you guys. I am
B,
proud of you.
decreased
So,
need for rest. C, insomnia. Or D, decreased respiratory rate. Let's see, what do we have here? Isidore, congratulations. I'm so happy to hear that. Lots of passing, so you guys are doing very good. All right, here, 3, 2, 1. The correct answer is C, insomnia. Menopause-related hormone changes can lead to sleep disturbances, including insomnia. All right, question 49, you guys. Which electrolyte is affected by adrenal gland dysfunction? A, sodium. B, calcium. C, iron. Or D, magnesium. This is a difficult question too, but I have faith in you guys. You guys are smart and you're going to get it. All right, here we go in 3, 2, 1. A, sodium. The adrenal glands regulate sodium balance through aldosterone. All right, last question. What is the best way to prevent diabetes complications? A, ignore the symptoms. B, maintain stable blood sugar. C, avoid all carbs. Or D, increase salt intake. All right, I'll give you 5 more seconds for this one. In 5, 4, 3, 2, and 1. The correct answer is B, maintain stable blood sugar. So keeping the blood sugar within a healthy range prevents long-term diabetes complications. So always remember that caring CNAs become caring nurses. If you guys haven't already, you can like and subscribe to the Florida Training Academy site. And thank you guys for joining us. Again, here is the page for Florida Training, so you guys can comment, like, share, and subscribe. And thank you so much for joining us. Good luck with everything, and I hope you guys have an amazing week. Thank you guys for being patient. Thanks for interacting with me, and I appreciate you all so much. And I hope that you all have a good evening. Get the likes up, please. We're definitely trying. Thank you. Thank you for what you do. Thank you, guys. When is another class of anatomy? Nurse Eunice is going to do a presentation on Wednesday. She'll be going live. Thank you. Thursday is your exam. Mark Lee, good luck and best wishes to you. God bless you as well. All right, you guys. Well, it was nice spending the evening with you all, and you guys take care. I'm going to be logging off of here, and I'll see you guys next week sometime. All right, I'm shutting it down.